All right, it's Joe Johnson of Cancer Dudes Live More, and today I've got another segment in my ketogenic diet interviews. I got Dr. Colin Champ on with me, who is a radiation oncologist in Pittsburgh, Pennsylvania, and an expert in ketogenic diet and its applications to cancer. He's also a fellow MIT grad like myself, so thanks for coming on, Colin.
Thanks for having me, and I apologize for the lighting situation. I just moved into a new apartment, and I don't have a lot of lights. So.
Fair enough. We'll do what we can.
All right. Thanks for having me on.
But, so yeah, I mean, probably when you were at MIT, you didn't expect you'd be working with cancer patients someday. I know I didn't.
Yeah, not at all. I mean, I started out as an aerospace engineer, shifted around a couple times, and somehow ended up in medicine. But yeah, never saw that one coming going in.
That was kind of the same for me. I studied mechanical engineering, and never thought that I would be here where I am today. But I'm happy with it, as I know you are. So it's a good place to be. But yeah, so I remember when we talked before, you said you'd kind of been teaching people about nutrition and setting up diets for them in college and stuff. And kind of how'd you get into the cancer area?
Yeah, it was just through medical school. I got more and more interested in the population of cancer patients. They're great to work with. It's one of the scariest things you can encounter in your life. It's one of those things that I think the two things people are most scared about is losing their sight or getting cancer.
Mm-hmm.
It's just a population that's, in that regard, it's great to work with because you really just want to help them.
Mm-hmm.
And it was tough for me initially because it pushed away from my desire to be working with nutrition and diet, those kind of things. But, I just love working with, I'm sure you have the same thing. I love working with cancer patients so much that I went that route. So, only recently in the last couple of years that I've realized that diet, nutrition, and cancer are integrally related. So probably right back to here.
Right, exactly. And yeah, anybody who's watching this video, don't worry, you're not losing your sight if you can't see Colin.
I think it's getting darker.
Yeah. But it's all good. So yeah, so what are you doing now as far as diet and nutrition? How are you incorporating that into your work with your patients?
So I'm trying to get I have a protocol done. I'm just trying to get it up and running and through the IRB, the Institutional Review Board. But it's ketogenic diet for patients with brain tumors with glioblastoma multiforme, which is a very aggressive brain tumor. And I'm also I have data already of patients that did this treatment. Currently trying to get that published. So it's hard. Some people are very intrigued by the data, by the diet, and by ketogenic diet. Other people, turn their head and say, "Oh, it doesn't matter." So even in my institution, even people that did the research with me, I send out my data, and several people respond. This is amazing. This is revolutionary. And then other people don't even respond because they think it's a waste of time. So big mix in that regard. But the other thing I'm trying to figure out ways to incorporate fasting and also to incorporate exercise. Besides the obvious telling people to exercise, telling people to do resistance training, but actually have some kind of way to quantify methods in which cancer patients will actually listen, will actually follow directions, will actually enjoy exercise.
Mm-hmm. And now, what was some of the data that you were mentioned? Basically,
the effect of a ketogenic diet on blood glucose. So there's a handful of studies showing the higher a patient with a GBM, this brain tumor, the higher their blood sugar is, the worse they do, the shorter they live. And it can either be an overall average of their blood sugar or it can be spikes. So one study from Johns Hopkins showed if you had 3 blood spikes over 180, those patients actually live significantly shorter. We're talking a large amount of time is cut off their life because of that. And also we give patients that have headaches or a lot of intracranial pressure, we give them steroids, a drug called Decadron, which causes blood sugar to shoot through the roof. So it's really a less than ideal situation where we know these tumors can eat sugar, we know high levels of sugar will lessen your survival. We also have to often give them medications that increase sugar. So I'm trying to look at ways where you could stop that flux of sugar through the blood-brain barrier into the brain to feed these tumor cells, and ketogenic diet is one of those. So my preliminary data was looking at that, basically how low you can get people's blood glucose levels.
Sure. And I'm assuming that lowering that blood sugar would be important for other cancers as well, not just brain cancer.
Yeah, exactly. Brain cancer is an easy target because there's a blood-brain barrier which only lets certain things through. So in theory, if you get your ketones pumping to a high enough level, you're not going to have as much sugar going across the blood-brain barrier. And GBMs are so metabolically active, it seems like a clear choice for this type of diet. And ketones are neuroprotective. So as patients are getting radiation or they have surgery, which could cause damage to the neurons and structures in the brain, ketones may actually help to protect those structures from damage.
Right. And I believe that normal cells can feed on ketones, but the cancer cells cannot. Is that right?
That seems to be the case. There is varying data, but the overall theme seems to be that cancer cells don't have the functioning machinery, the mitochondria, that normal cells do. So that's one way to kind of exploit the difference. Now that being said, our body's very good at keeping blood glucose to a certain level. So even if you eat 0 carbohydrates, the body's going to go into gluconeogenesis and raise your sugar levels up. And that's a common criticism that I get with the ketogenic diet. Say it doesn't really matter because your body's going to raise the blood glucose up. And our data definitely shows that's not the case.
Sure.
Stay tuned.
Yeah, stay tuned for the results on that. But so now when you're, say, recommending a ketogenic diet to your patients, how do you instruct them to carry it out? What are you telling them to eat, and how do you kind of outline it for them?
So I'm gonna rotate here to try to get some more light.
Sure.
I apologize yet again. Did that help or hurt?
That's a little bit better.
So, obviously the diet's mostly fat. The carbs part is easy. You say you can't eat more than X amount of carbs, whether that's 30 or 40 grams per day, and they get that down, after some "are you serious" type questions. And then some of the harder part is actually getting down to protein. If your protein's too high, it can bump you out of ketosis. It's hard. It's been 40 years now of telling people to eat a low-fat diet, a high-protein diet. So now when you tell them to do the exact opposite, it's just mind-boggling. We're wired beings. We're used to doing the same things over and over again. So that's a difficult situation. But the fattier meat cuts. Some people argue and say you shouldn't have dairy on it because of gluten and some other things, but it's pretty darn hard to eat a 80% fat diet without having some dairy. So, think of the whole cream in the coffee, full fat cheeses, eggs, but definitely the egg yolks, especially, can have some whites in there as well. And then I'm not a huge oil fan in general, but coconut oil, avocado oil, macadamia nut oil, olive oil. And coconut oil or MCT oil is a good one because in itself it can actually cause ketone production. So it might help those people that are kind of borderline from making ketones. And then there's a bunch of new books coming out. There's new recipe guides to help these people out. So it gets tough for people to eat the similar foods on a daily basis.
When you say you're not a big oil fan, you mean like soybean oil and canola oil and things like that, corn oil?
No vegetable oils.
Right.
They get oxidized. They bring in a bunch of free radicals. Now, if we're treating them with chemo and radiation, they're already getting a hefty dose of free radical damage. So I don't think we need to bring about more of that throughout the rest of the body. So that's why I definitely stay away from that. With radiation and those oils, there's not great data, but to me it makes sense.
And as far as the protein, do you recommend like a half a gram per pound of body weight, or what kind of recommendations do you give on how much people should have?
Yeah, I try to keep it. Initially, I just say to cut carbs, and then I say to minimize protein, and I see if they start pumping out ketones. And if they are, then I'll just say keep doing what you're doing. And I have them fill out a a food journal, on Fit Day or one of those sites, so we can check to see what they're doing. And generally, some people at 30% of their diet being carbs and protein combined, mostly protein in that 30%, will produce ketones. If they don't, then I'll have them go down to about 20% of the diet being protein and carbohydrates. So they can, with the majority of that 20% being protein. So I don't have a dead number for when I initially started doing it, I had these set numbers for everyone, and it made so much sense in my mind. And it's really tough for people because everyone's different. So I found that method it's a little more labor intensive on my part because I have to continually check in with them to see if they're making the ketones or whatnot. And it's more individualized, and I think it works better for the patients.
And so how, if people are doing, say, the ketogenic diet at home, how will they know if they're producing ketones?
So the first 2 weeks in the diet, I have them use urine strips. So, you basically just pee on a strip, or you can pee in a cup and dip it into there. And these are diabetic patients to see if they're making ketones. And that's a pretty good marker for the first 2 weeks. And they're very easy to use. They light up pinkish purplish, you're making ketones. Once you start using the ketones after 2 weeks, those generally don't work as well because you're burning the ketones for fuel. And that's actually around the time patients start feeling more energetic from the diet. So at that point, I either have them do finger sticks, and if they're getting a drug which is called temozolomide, we're usually checking their blood labs anyway, so I'll throw in a ketone test in their blood labs. That's obviously the best case scenario because that gives you a quantifiable number that's pretty accurate. The finger sticks are good as well, but they're not as good as a blood draw. That being said, I don't want to be drawing blood on people too often. So those are the two methods. And Jimmy Moore at FX showed us this. It was a thing you breathe into. It gives you a number on how many ketones you're making that way. So that might be something to implement in the future.
Right. And so in kind of that first 2 weeks, I'm assuming that's when people are kind of adjusting. Their bodies are adjusting to burning the ketones as fuel. Are people going to notice lower energy kind of in that time, or what are they going to notice?
Well, I have them supplement with salt, because one of the biggest things when you get on the ketogenic diet, when you just stop eating carbohydrates or minimize your carbohydrates, you get a lower amount of insulin. Insulin's a hormone that pulls sugar from your blood and into your cells, because if the sugar in your blood gets too high, it could be fatal. It's toxic. So, if you're not eating carbohydrates, you don't really need as much insulin. And as a side note, insulin can also feed the tumors, but that's a whole other story. But insulin also acts on the kidneys to retain sodium. So as soon as you stop eating the carbohydrates, you stop getting the insulin spikes, your kidneys really start releasing a lot of the sodium in your urine. So if you don't eat a decent amount of sodium, have broths, those kind of things, you can feel pretty run down. And I get people at first saying, I feel so run down, it's because of the carbs, it's brain fog from low carbs, and then you give them salt and they perk right up within a half hour. So that's helped too. But the first 2 weeks, it's just a different feeling. And then in myself and others that go in and out of ketosis, when we get into that first initial kind of 2 week period, you actually get kind of a clarity of thought, and it's not a bad feeling actually. It's quite a good feeling. But when you first experience it, it's something different. So that can be alarming. So
that's after the 2 weeks you get the clarity of thought, or when does that come about?
I notice now as soon as I go into ketosis, I'm just kind of like ready to go. But anytime I'm lowering my carbs to a certain amount where I know I'm going to go into ketosis for a couple of days, I bump up my salt. So I think I kind of bypass those first couple of issues that come about. So I think patients generally, it's a 2 week period, and even I'm blanking on his name, but this guy that went up and hung out with the Inuit Eskimos for a while, and he's one of the first people that brought the ketogenic diet back here. He actually wrote on the same thing. It's a 2 week period. Then after that, you generally feel pretty good.
Sure. And so people might need like an extra teaspoon or two throughout the day, or do you have any kind of quantified numbers? Or
I have them do about a spoonful in broth, so about a gram or so in broth 3 times a day.
Okay.
And I also have them when they make food and vegetables and those kind of things to be pretty liberal with the salt. And the other great thing is a lot of vegetables like, kale, Brussels sprouts, those kind of things, you eat them raw or you eat them steamed, they're not very good.
Mm-hmm.
You put oil or butter on them and salt, and they are delicious.
Right.
So that's one easy way for patients to get more salt.
Right.
And what's that? Sorry.
Yeah. And your body needs the good, like, Himalayan pink salt, something like that too. It doesn't,
Exactly. That or sea salt, something with a lot of minerals as well. So that, and generally, if they're having too much, they'll start to retain a little bit of fluid.
Mm-hmm.
So it's pretty easy to tell. And then you just lower it.
Mm-hmm.
So if you're not having enough, you start to get run down. Once you're on the diet for a couple months, you really start to feel your body, to know what you need to do.
Mm-hmm. Right. And, so just thinking about the high salt and the high fat, that's kind of completely opposite to everything people have heard before and maybe everything they've heard from their doctors. So what can you say about that?
Yeah, it's 100% opposite of what they're hearing. In this scenario, it's somewhat easier because, it's considered a form of treatment.
Mm-hmm.
So physicians will generally be okay with it. I've had a couple patients do extremely well, and they're neuro-oncologists who are suspect at first. They jumped on the bandwagon. They're saying this is great. The patient's doing really well. The other thing is it really empowers the patients to kind of take control of their own health.
Mm-hmm.
It really gives them a proactive feel, and they're just like, I have patients that just can't wait to get their next MRI just to show that there's nothing there, that they're doing well. And that's a very different feel than you get from when you're just kind of, I'm blasting you with radiation, we're giving you chemo, and just kind of deal with it, and we'll get through this.
Mm-hmm.
You take that, and then you juxtapose this, where these patients are like, here's my ketone numbers, they're very enthusiastic. It changes the whole face of treatment, and it's a pleasure as a physician to see, and I think it really makes patients, it gets their mind off of the issue at hand, which is not a great one,
mm-hmm.
and instead it makes them actually enthusiastic about proactively fighting their disease.
Mm-hmm. Mm-hmm.
So it's tough at first for all patients to do, but a lot of them, when they do it, they love it. They continue to do it. They get fancy with the recipes.
Mm-hmm.
They try to make it more palatable for others.
Right. And now, have you seen that people going on the ketogenic diet, that helps to make like the treatments, the radiation or the chemo and that kind of thing more effective?
Yeah, it's animal studies show that to be the case.
Mm-hmm.
But I hate to jump from animal studies to say that it's 100% effective in humans, because
mm-hmm.
that's led us down the wrong path before.
Sure.
I've had some cases that are, the survivals have been better than would be considered the average survival. So it's not enough patient numbers where I can make any, grand conclusion. It's not a randomized study, which I hope to have done. But the preliminary data is very intriguing. Blood glucose levels stay extremely low. Toxicities, it's very well tolerated diet.
Mm-hmm.
Toxicities don't sway too much from chemo and radiation, as long as it's severely calorie restricted.
Mm-hmm.
So I think thus far I'd say the results are encouraging.
Mm-hmm.
No one has lived shorter than they should have.
Mm-hmm.
Several people have lived longer, and I'm still waiting to see how a bunch of them do. They're doing well right now, so
right.
We shall see.
Right. Yeah, and I guess I was just talking with a woman with breast cancer who said she felt a lot better, going on the diet as well. Maybe that's what people can kind of watch out for, having more energy and just losing weight and losing fat, I guess I should say.
Absolutely. Breast cancer is one of those where we don't know for sure if it'll work, if it'll help to make treatment better.
Mm-hmm.
But we do know if you're losing fat, that you're going to do much better.
Mm-hmm.
Especially if it's an estrogen receptor or progesterone receptor positive breast cancer, they're estrogen hungry, and your fat cells make estrogen. So the less you have of that pouring out of your cells, the better you're going to do. And we put breast cancer patients on medications to block the estrogen.
Mm-hmm.
So imagine if you have patients that come in. I had someone that was 260 pounds, and during treatment, I implemented these kind of dietary changes. Weight drop. I think it was about a 30-pound weight loss, which
mm-hmm.
I think some people would get worried about. But when you're 260 to start, these are good things. Imagine how many fat cells are no longer producing estrogen in that patient. So
mm-hmm.
it's a big lifestyle change, and then they feel better, so they exercise more, they eat better. It's kind of once you get the ball rolling. Just
Mm-hmm.
a lot of lifestyle changes that follow.
Right, right. And now, what do you think about cancer patients that have had success, with more like going vegan or doing the raw food or things like that? What do you think about that stuff?
Yeah, I mean, first and foremost, the most important thing is to not be overweight, not be severely overweight.
Mm-hmm.
So if that's the diet that they need to go on to lose weight,
Mm-hmm.
then I think that's great.
Mm-hmm.
I don't think it's the ideal diet. I think it's more nutrient-dense diets are better, in my opinion. But, there's no one right answer for everyone. I know a lot of breast cancer patients, this is kind of a continual issue that I have, they have issues with food addiction. They can't stop eating, and they're trying to lose weight, but they're always hungry. So I actually would prefer those patients to eat nutrient-dense foods, because nutrient-dense foods generally fill you up.
Mm-hmm.
A lot of breast cancer patients are told to eat the typical low-fat, high grains, red, those kind of things in their diet, and those things increase your appetite.
Mm-hmm.
So, and a lot of vegan and vegetarian diets rely on those are the staples of those diets as well. So.
Mm-hmm.
That's just one thing that kind of worries me
Mm-hmm.
in regard to those. But once again, if it's working, if they're making healthy lifestyle changes, if they're losing weight, then all things are good.
Right. And by nutrient-dense foods, you mean like the healthy fats, the coconut oil, avocado, and grass-fed butter and grass-fed meats, things like that.
Absolutely. And, leafy green vegetables that are obviously part of, I think every healthy diet incorporates leafy green vegetables. Leafy green vegetables with healthy sources of fat. And even some grass-fed butter, which has conjugated linoleic acid in it, which helps fight breast cancer.
Mm-hmm.
That's a good nutrient-dense meal that tastes good, that makes patients, after they eat it, happy and satisfied, and then they're no longer hungry.
Mm-hmm. Right. How about another book I get asked a lot about is the China study. What do you think about the China study?
Yeah. I applaud Colin, who's the author, for really promoting nutrition and showing that it can have benefits, and it could also, foods you eat could cause cancer. A lot of what his study was based upon was these, some mouse studies on casein protein and how it could cause excess liver cancer, and after you encounter aflatoxin, which is basically a chemical that causes carcinogenesis within the liver.
Mm-hmm.
But if you actually look closer at the data, the mice that got the casein, some of them got more tumors. He did a low casein and a high casein diet. But he had a lead-in where he did the opposite. And actually, the mice that got the higher casein diet lived the longest as well. So then you start to wonder, you don't want to get cancer, but if you're going to die shorter anyway from eating a really low protein diet, does that make any sense either?
Mm-hmm.
So, it depends on how you want to frame it. Now, if you're obviously very pro vegan, vegetarian, you're going to say, oh, look, you eat casein, which is an animal protein. It's very bad for you.
Mm-hmm.
You could also say, oh, look, you eat casein, you're going to live longer.
Mm-hmm.
So it's not clear, and that's why it's in a book. It's not a lot of the data is not in peer-reviewed journals.
Mm-hmm.
So I have issues. There's a lot of dietary things you can do, and you and I were talking before. If someone has cancer or someone doesn't have cancer, and you only let them eat 600 calories a day, their odds of getting cancer diminish. And if they have cancer, it stops growing.
Mm-hmm.
A lot of this is in animal studies, but it's the same with chemo. If you give someone a high dose enough of chemo, you're going to kill every cancer cell in their body.
Mm-hmm.
You're probably going to kill every normal cell in their body too.
Right.
And a lot of these diets and starvation is no different. If you starve yourself, tumor cells can't grow because they don't have enough nutrients, but neither can your cells. So you're kind of just starving everything.
Mm-hmm.
So you can do that with low protein diets as well. You can do that with low fat diets. It doesn't mean it's necessarily healthy.
Mm-hmm.
And radiation chemotherapy is no different. If you give someone a high enough dose of radiation, you can certainly get rid of the tumor. But the goal here is to allow people to live a great life after they're cured.
Mm-hmm.
So it's always a balance.
Right.
With treatment or diet.
Mm-hmm. So kind of on the topic of calorie restriction, that's kind of a big topic bandied about. What are your thoughts on, do people need to restrict calories? Is that important? Or, what are your feelings on that?
So I think extreme calorie restriction has shown promise. I don't think it's possible in humans. I think mice have a higher metabolism, so when they restrict calories in mice, it has more of an effect. So my goal really is how can we mimic calorie restriction in humans without causing so many side effects and so much damage. So I frankly don't think calorie restriction per se is necessary. I think carbohydrate restriction, especially compared to the standard American diet, is absolutely necessary to downregulate insulin, which we discussed, and some of these other pathways. That being said, there is a lot of data that shows that protein restriction may help as well. So when you put those two things together, the only food left to eat is fat. So you do have to eat a higher fat diet. In the animal studies with radiation for GBMs, for the brain tumors, they didn't start the mice. One of the most recent studies by Abdul Wahab, where they cured 9 of 11 mice, which is pretty astounding, and they didn't do calorie restriction. So I don't believe it's necessary. I've seen patients that have done calorie restriction, and it's generally a scary sight. It's more toxic than a lot of the radiation I give. It's more toxic than a lot of chemotherapy these patients receive. So I have not seen compelling data that it's necessary. Maybe that'll change. I think fasting and carbohydrate restriction or ketogenic diet are likely methods where you can circumvent the side effects of calorie restriction, but still give patients the benefit that they're looking for.
And so when you say fasting, what do you mean by that specifically?
So there's actually a study in humans where before they gave them chemo or before and after they would fast them. The timing varies, but fasting it's a form of calorie restriction. We've hit semantics here, but a 16-hour fast gets your insulin rock bottom. It will create ketones, which, as you alluded to, can fuel our normal cells. We may not be able to fuel tumor cells. They actually may make cells more vulnerable to oxidative stress, which is how chemotherapy and radiation therapy works. So it can also protect our cells from oxidative stress. So when you fast, it makes our cells more resilient. It's almost like an ancestral evolutionary type thing where we used to fast in the past. Our cells figured out ways to be more industrious during these times. And there's also, they recycle spare parts and those kind of things in extra cells. And, spare parts and extra cells may be cancer cells. So I think it gives you the benefits. But a 16-hour fast is not that difficult. Eat a dinner around 5, and then you don't eat again until noon the next day. You've done a pretty long fast. And it gets easier over time. I think fasting is much easier than calorie restriction. You can do 1 or 2 fasts a week, get the same benefits without starving yourself all week long.
And that might be important to do, you said, before like the chemo or the radiation treatment?
I think so. And, there's only a small study with chemo. I would love to do a study with radiation. These are the kind of studies, when you present these to your institutional review board or your consulting physicians, they think you're crazy. Because all they were taught was that cancer patients need to eat. They cannot lose weight because if they lose weight, it is a poor prognostic factor. But oftentimes you can stuff them full of as much food as you want and they still lose weight because it's not an issue of food intake or outtake. It's an issue of a very aggressive metabolically active tumor. It's eating a lot of the food they're eating. So then you get to the point where if we're stuffing cancer patients full of food, are we feeding them or are we feeding the large tumor?
Right.
So anyway, back to that point. So it does bring about a lot of reservation with other physicians, and rightly so. But I think it'd be a great study. I think it may benefit patients, and that's most important.
And 16 hours is all you need, pretty much? Or do you think there's any benefit to doing longer?
I think the group that did that initial study with the chemotherapy patients had them doing a much longer fast. I think they would probably agree with a longer fast, but more than 16 hours, I could do a 24-hour fast every once in a while, or a 18, 20-hour fast. Frankly, when I do it, I hate it. So I can't tell my cancer patients to do something that I can't even do.
Sure.
It's difficult. So I think it needs to actually be doable. So,
Right.
If everyone fasted and did this crazy ketogenic diet, less than 20 grams of carbs and all this stuff, that's great. But at the end of the day, how many people can actually do it? We need to make it
Right.
doable.
So you've never done any of the 7-day fasts or anything like that, I'm assuming?
I don't know if that'll even be helpful.
Right.
I'm happy with a 16-hour fast every now and again, and then ketosis every now and again.
And for you, every now and again, how often is that?
I usually fast on Saturday and Sunday morning.
Mm-hmm.
It varies. I eat dinner the night before, then I don't eat again until lunch. I do have coffee in the morning, so
Mm-hmm.
I don't know. I guess that counts, but I don't count. I don't like to fast when I go to work. I'm a little bit crabby.
Mm-hmm.
My patients like me better when I eat.
Mm-hmm.
So I don't do it during the week. I know some people that do. I just don't tolerate it very well.
Okay. But it sounds like, again, kind of figuring out what works for you. That's what people need to do. Figure out kind of what diet works for them, what kind of, if fasting works for them, kind of listen to their bodies.
Absolutely. I mean, if it makes you feel miserable, if it makes you crabby, if it makes you irritable, it's probably not right for you. And granted,
Mm-hmm.
some of these things take time to set in.
Mm-hmm.
But I've done self-experimentation for several years now, so I really feel like I know what my body can handle or not.
Mm-hmm.
And I think I'm a pretty tolerant person when it comes to crazy dietary manipulation. So if I can't tolerate it, I fully understand if my patients can.
Mm-hmm. Sure. Yeah, it's a good point. I guess that brings me to exercise too. That can be something that people can hate, but something that's very important. So what are your thoughts on exercise?
Yeah, I think exercise, especially acute, just kind of intense exercise, probably provides similar benefits to fasting and to ketosis. It upregulates this pathway. I don't want to get too sciencey here, but it's called the AMP kinase pathway, and that blocks some other pathways that can cause tumor growth, similar to carbohydrate restriction and similar to fasting.
Mm-hmm.
And it builds up more mitochondria in your muscle cells, and mitochondria, once again, are the powerhouse of our cells, and ketones can work off of.
Mm-hmm.
Fats can build energy, but not the case in cancer cells. And mitochondria actually provide some free radicals and other things to help kill cancer cells. And there's actually data in mice that if you upregulate mitochondria, that in itself can kill cancer cells and stop tumor growth. So clearly it's a potentially a very potent weapon. And I think it's great that we tell patients to walk, and I walk myself a lot, but I do think we need to get people, not necessarily in the gym doing squats, but all my female breast cancer patients, I tell them, even if you're sitting on the couch watching TV, get some heavier weights, do some resistance training. Something that takes your breath away, makes you sweat, because that'll make your bones stronger.
Mm-hmm.
It'll make you more insulin sensitive, so it could lower circulating insulin levels. And it doesn't really make you lose weight. Exercise doesn't make you lose weight. It's more of a diet thing.
Mm-hmm.
But it does, create a lot of changes and give you energy and create a lot of lifestyle adaptations that make you want to be more healthier overall. So I think the benefits to exercise are unlimited. I think it's, like I said, it's all similar. It's, once again, we exercise a lot in our past. We're always walking, and then we did intense exercise. And so it makes sense that our body uses these pathways to help itself to be more healthy.
And now somebody with cancer, do they have to worry about going too hard or too intensely, or is it something like high-intensity interval training? Is that going to be okay for them? Or
I think depending on what you're getting, if you're a breast cancer patient or prostate cancer patient, you're just getting prostate radiation, breast radiation, probably can go a lot harder than most people. There are issues after surgery. You need to make sure the surgical sites are healed. Women with breast cancer that get axillary dissections in their armpit have some tightness in there and trouble raising their arms, so that has to be done, safely. I don't want them to get hurt. But I don't think if you're getting chemo, if you're doing these other things, and you're somewhat fatigued, you don't need to go to all out, crazy exhaustion here. But I do think to get the heart rate up and to get the muscles pumping and really get some force on the bones to help with bone strength, I think many cancer patients can benefit from that.
And then at the same time, maybe doing some walking and yoga and kind of the more relaxing and stretching, things like that.
Absolutely. That provides other, psychological and mental type benefits as well. Meditative almost type benefits.
Right. And, as far as the ketogenic diet, have you found that there's any contraindications? Anybody that it might not be the best for? Yeah,
patients with hepatobiliary or pancreatic type lesions that had their pancreas removed, that creates some enzymes that help digest fat. So if you don't have those, eating an 80+% fat diet might be difficult. It can be done. You have to just get some someone has to help to balance your enzymes. So you definitely need to see a physician. You need to see a dietitian. I mean, I suggest that anyway all the time, but you need to have someone closely monitoring that. So those patients may have some trouble. And then there's patients that have swallowing issues due to either radiation toxicity, due to if they have an esophageal cancer, sometimes they have to have a tube put in their stomach. And, that brings with itself other issues because then the food gets put straight into the stomach. Those patients actually may have an easier time doing a ketogenic diet because you're not actually eating the food, but they may not tolerate such a high amount of fat as well. It takes a little bit of getting used to.
Sure. And then, kind of the topic of detoxification gets talked a lot about in the cancer world. Do you have any thoughts on, detox and things like that?
Detox is one of the things when I hear I kind of get, I don't want to say I roll my eyes, it's too strong of a statement, but it's such a blanket term. I don't even know what it means anymore. My buddy Roger, who I do a podcast with, he discussed his version of detox, which is fasting or a ketogenic diet or whatnot, which is a way that when you're fasting, it puts these cells in a position where they say, there's not a lot of food, there's not a lot of energy, I got to preserve, I have to get rid of the junk, so it kind of cleans out your cells. It gets rid of potentially some cancer cells. I think that's a good way to do a cleansing type thing. When people think of cleansing, they think of coffee enemas or something to kind of clean out your bowel. I think cleaning out your cellular machinery is a much more potent type of doing a cleansing or whatnot. So I think that's the way to do it. And I think that's probably why a lot of these patients that were getting chemotherapy had less toxicity when they did the fast. It's getting rid of a lot of these things in your body, and it helps you deal with free radicals. So if you're getting chemo or you're getting radiation, you have all these oxidative issues going on. It potentially can help you get rid of those. So,
and that can be done with something like the 16-hour intermittent fast or something like that.
Absolutely. I think that to me makes a lot more sense than these cleanses and whatever else. And I'm not putting them all down. I'm sure there's some that make some sense.
Sure. And so you mentioned Roger. I guess I haven't mentioned your site yet, which is cavemandoctor.com. So what are people going to see if they go and check out your site? I know you guys have a podcast and stuff too.
So it's generally, I look at health and nutrition. I try to look at it from common sense point of view. I don't know if that's too simple of a way of looking at it, but there's clearly ways we lived over the past millions of years. Fasting is one of them. Ketosis is one of them. When you put us in scenarios where we encounter a lot of new modern age foods, carcinogens, toxins, those kind of things, it's pretty obvious what happens. You give people really high carbohydrate diets, really high sugar diets that they're not used to, they get overweight, they get cancer. So it's kind of looking at the history of humans to think what made sense back then. It might make sense now. And it's as simple as my grandfather's in 96, my grandma's in 92, they live close by, I see them all the time. And they have these stories where when we were younger, we ate lard, and we did this, and we did all these things that are supposed to be so bad for you. Why are we still alive when we're in our 90s? It comes around, you think maybe it's actually not that bad for you because we've been doing that for several million years. So I've kind of tried to look at it from a global perspective, and I try to pick apart the literature and the research and try to make it into more simpler bits for my readers to digest. So we have a podcast on it as well, which is generally weekly or every other week. And I've turned to that more so that people, initially I did a lot of writing, there's a lot of reading for people, but they do like to listen to things while they're driving to work, those kind of things. But I'm trying to get my website ramped up a little more. I have a lot more content coming, but with the full-time job, it's rather difficult.
And somebody with cancer coming to your site, are they gonna have some stuff geared for them, or are they gonna learn some things? Or
yeah, there is. I generally sway towards cancer since it's my field, and I'm trying to ideally have a whole new section of it where it's just cancer. Just trying to bring together a team that can do those kind of things for me because a lot of the website I did on my own, and I don't have the skill set to continue.
Right. Cool. Yeah, I'll definitely post a link to the website in with the interview. But, kind of before we wrap up, I guess I'll ask if, somebody's just been diagnosed with cancer, what's maybe the one or two top pieces of advice that you might give to them?
Wow. So it's a great question. First and foremost, I assume they're going to go on Google and become what we call a Google MD. So I would say, amass as much information as you can, but take everything with a grain of salt. There's no filters out there. Anyone can say whatever they want.
Mm-hmm.
That's the first one. And, the second one, first off, it's not necessarily your fault. A lot of people get cancer. About 50% of the population gets cancer, and we don't know why for a fair majority of them. So that's first and foremost. So get the thought process that it's your fault out of your head, and just get ready to move on and make those tangible changes. And everyone needs some motivation to make lifestyle changes. And for a lot of people, it's diabetes, heart attacks, a friend getting some kind of issue, and then for a lot of people, it's cancer. So puts people on the right track. I've had patients with very curable breast cancer make amazing lifestyle changes, start exercising, start eating healthy, and actually say, thank God I had this diagnosis. It really changed my life, and now I know I'm going to be healthy from here on out. And it may have prevented them from having a major issue down the road. So it's not the end of the line. Lifestyle changes will help, and just use it as fuel to keep you going, living a healthy life.
Awesome. Yeah, it's definitely great advice. Take it and spin it to the positive. Use it as an opportunity. So I love that. That's great. But well, Colin, thanks so much for coming on with me today. This has been a great conversation. I know a lot of people are going to get a lot out of it. So I look forward to talking with you again soon.
Thanks. Yeah, thanks for having me on. It's been great chatting. I apologize about the light situation again. Kind of look like a orange mask on Halloween.
No worries, it'll be all good. I'll post your picture up there too, so people can see it. So,
right.
Awesome.
Thanks again for having me.